Hey everyone, I'm Dr. Thistle, helping you build a durable body. And today I'm going to be doing something a little bit different. I'm going to be doing an anatomy tutorial using some anatomy software that I have. Because I think it's really important that you understand and you be able to visualize the muscles that you're actually working with your exercises. And so today I'm going to cover the hip flexor muscle, the psoas. So we'll go over the basic anatomy of the hip flexor and its role and function in how your body actually operates. So I'm excited to get into it. Let's do it. All right, welcome to the anatomy lab. So today I'm going to review the hip flexor muscle group, also known as the Iliopsoas, and this will be our model for today. We'll call him Bob, and I am going to put a layer of muscle on Bob so we can look at the first muscle in the Iliopsoas group, which is the Iliacus right there. And the Iliacus starts at the top of the pelvis here, goes along the iliac crest, and then goes down through the pelvis and attaches to the top of the femur right there. And the main movement of the iliacus is hip flexion, so bringing the knee up. And so walking, running, going upstairs, anything like that, the iliacus is going to be involved. The next muscle in the Iliopsoas group is the psoas part of that. That is the Psoas Minor. And so let's put another layer of muscle on Bob. There we go. And the Psoas Minor is right there. It's that long, thin muscle. Starts at T12 and L1 right there. Goes all the way down and attaches to the top part of the pelvis here. So the main movement of the Psoas Minor is actually trunk movement. So trunk flexion, bending forward like that, and also lateral bending or trunk lateral flexion like that. The third and the largest muscle of the Iliopsoas group is the Psoas Major right there. And that is a very large muscle. It starts at T12 on most people, and it goes all the way down through the lumbar spine, the low back, the pelvis, and then attaches to the femur. You can see how it kind of wraps around the top part of the femur right there and attaches to the back part. And the main movement of the Psoas Major is a combination of the Iliacus and the Psoas Minor. So it also does trunk flexion like that. It does trunk lateral flexion, so bending sideways. And then it also does what the Iliacus does, which is hip flexion there. So again, being involved in walking, running, going upstairs, anything like that. And what's important to note about the Psoas Major is as it goes down, it has attachment points to each lumbar vertebrae. You can see here it attaches to each vertebrae in the low back as it goes down. And that's important because if it is tight, if it's asymmetric, if it's not functioning properly, it's going to potentially put a pretty significant strain on the low back, the pelvis, and the hip, all of the areas that it either attaches to or crosses. And with both the Psoas Major and the Iliacus, they are in a shortened position when the hip is bent, when the hip is in flexion, like when we're sitting. So people that sit for long periods of time for their work or for driving, whatever it may be, those muscles are going to be in a chronically short and tight position. And so that's very common these days. So any good hip mobility program is going to include opening exercises that involve hip extension for lengthening the hip flexor group, particularly the psoas major and the iliacus. And another aspect of that is glute activation, because a lot of times if the hip flexors are tight, then the glutes are not going to be firing the way that they should. So you're going to get a lot of compensation in the low back and the hip. All right, so thanks for visiting the anatomy lab, and just let me know if you have any questions.